Welcome back to CBS This Morning. Health officials are very worried about another new coronavirus wave, and they're asking states, do not lift your restrictions so fast. COVID cases are rising in at least 27 different states, plus Washington, D.C. The number of cases in the entire U.S. is up 13% in the last week. Meg Oliver is in Hackensack, New Jersey, outside of a hospital that's seen an increase in patients there. Meg, this is not good. What are you hearing from the frontline workers?
Gayle, good morning. Hospitals like the one behind me say they're seeing more and more COVID patients ages 18 to 50. That's because as of yesterday, 50% of Americans over 65 are fully vaccinated. As more contagious variants continue to spread, younger Americans are feeling the brunt of this latest surge.
It's been 2 weeks since Louis Carleglio checked into a Connecticut hospital with COVID symptoms. The 32-year-old came home Tuesday with an oxygen tank and IV marks on his arm, scars from a COVID battle that nearly spiraled out of control.
How bad did it get?
It began with a fever that I had for about 9 days, and it refused to break. At one point, I was on 40 liters of air with 60% oxygen, which unbeknownst to me was eerily close to the max that you can get for high flow air. The doctor kind of later on told me that I was basically going to be close to intubation.
How did it feel leaving the hospital?
Felt great. It was a beautiful day out today, so I got to breathe in some fresh air finally.
As cases rise across the state, hospitals are seeing more patients like Carleglio, according to Yale's chief clinical officer, Dr. Tom Balsazak.
We've seen about a 70% reduction in those over the age of 55 being admitted to the hospital. But what's that means is we're seeing a lot more 30 and 40-year-olds coming in. Just last week, we intubated a 21-year-old. That's really unheard of for us.
And how alarming is that?
Well, it's pretty concerning. I think the message is nobody is completely safe unless you're vaccinated.
Just 20% of adults over 18 are fully vaccinated. Despite that lack of broad protection, states are relaxing rules on masks and gatherings, giving more contagious variants opportunities to spread, says Dr. Ashish Jha.
Our best estimate right now is probably 50 to 70% of all infections in America are from B117, that variant from the UK. The issue is unvaccinated people getting together, and given the variants, it's still pretty risky, and I would avoid it. Everybody who wants a vaccine will have had one, and certainly by the time we get into the summer. So my key advice is hold on tight a little bit longer. We're not talking about months. We're talking about a few more weeks.
And Carleglio is urging his peers not to wait if they're eligible for the vaccine.
Before this happened, I wasn't necessarily rushing to get vaccinated because I always thought, I'm in a group that's 99.8% sure that I'm not going to die from it. My lung capacity is not exactly back. So getting up and walking around for me is equivalent to like going to the gym. So I need to take it slow.
Really glad to see him back home. Now, the recent uptick in the number of cases is happening mostly in the Midwest and the Northeast. Dr. Jha says that's likely due to the weather. It's still relatively cool here. People are gathering indoors, and that's where the virus spreads more easily. Tony?
Wow, Meg, a 32-year-old young man with oxygen, a 21-year-old intubated. It's a reminder that this virus is not done with us. Meg, thank you very much.
And so important to tell these stories, too, because they say that the vaccine hesitancy is going down, but there still is a lot out there. I always say, just look at the science, do the research.
You're so close.
If you're still on the fence about it. And we are so close, Tony. We're so close.